Hello there, welcome to another Wellness Wednesday. I am super excited because today we are going to talk a little bit more about how to overcome headaches and really get to the root cause of number one, what are they being caused by, but also what can I specifically do to help get rid of those or reduce their frequency so they're not causing as much of a disruption to my life. So today we are going to be doing a little bit different type of video. So normally I have short videos that are straight and to the point, but today I want to talk a little bit more about headaches because headaches are one of probably the top condition that I see in my office, followed by low back pain. So this week we're going to talk a little bit more about headaches, and then next week we're going to cover low back pain a little bit more in depth. But I think it's really important to understand more about what we do in our office and how we have a different approach to treating those. So we're going to get started with a presentation. I'm going to go ahead and share my screen. So here we go. I will get sharing with this, and then let me get this up and running. Okay, so hopefully you can see all this, but like I said, it's really important to realize that when it comes to headaches, we have to understand, number one, what they're caused by, but also what are the things that we're doing that may or may not be working for us? Because a lot of times, there are so many different things that contribute to headaches, but we really need to figure out how that applies to you specifically. So here at Freedom Chiropractic and Holistic Health, I'm Dr. Andrea Shanowski. I am a chiropractor and a wellness provider. I'm really focused on making sure we get to the root cause of your health and what we can do to help you. So if you want more information or to request an appointment, you can either call our office 309-689-6200, or you can go on our website, freedompeoria.org, to find more information and request an appointment. But for today, I want to talk a little bit more about headache statistics. About half the US population actually suffers from headaches. Now, 1/3 of neurology referrals, so that means neurologists, specialist doctors, those are actually referred to because of a headache evaluation to find out what's really going on or get an actual diagnosis for the type of headaches you are experiencing. Now, that doesn't mean treating it. That means actually diagnosing and saying, oh, you have migraine headaches or cluster headaches or this kind of headache. That's really what those referrals are for. And in some cases, those may be to order some additional testing and things like that to get to the root cause of things. Now, women are 2 times as likely to suffer from headaches than men. So that means that women are way more likely, 2 times likely, to have headaches more so than men. So women, listen up. This is super important because I feel like a lot of times when we do get those headaches, we kind of brush it off. We're stressed. We are hormonal. We got a lot going on. Or we just simply brush it off because everybody else's health is more important than ours. But in reality, when you are suffering with headaches, that can cause a lot of other concerns. The cost of headaches is not just monetary, but we are going to lose time with your family because when you're dealing with a headache, sometimes you have to go lay down. You may have to miss out on activities like your kid's soccer game or going to play with your kids because you're dealing with that headache. We can also isolate ourselves and even sometimes suffer from depression due to that chronic pain that's happening. And of course, we have financial losses and a little bit more about that. So financial costs of headaches are kind of ground shattering in numbers. According to the Journal of Occupational and Environmental Medicine, migraine sufferers actually spend about $7,000 per year on medical costs, and other headache sufferers spend about $4,400 per year. That is a huge cost dealing with those. Now, indirect costs, so that means everything from missed work to having to call in to having vacation time and things like that are lost, and also leaving early from work due to pain is about $12 billion every year. So that means that not only is your family suffering by having to foot those bills, your insurance costs go up because you're having to foot those bills. If you are a business owner or work in a business, that's also going to cost your workplace some money too, because they have to deal with, number one, you not being able to come to work and do your job, but also sometimes if you're away for a long time with, follow-up treatments and things like that, or getting more information done, or getting more testing done, those can really be a huge cost, not just for individuals, but for businesses and for just companies in general. So tonight we're going to talk a little bit more about the causes of headaches. We're going to talk about the more common ones. There are some ones that are pretty rare, things like tumors and things like that, as well as eyesight issues. And we're going to talk a little bit more about some of the problems that we're seeing right now with management of headaches and how to actually deal with those. And we're going to talk a little bit more about a natural solution and a holistic medicine approach to looking at how to deal with those and really giving you power back over your healthcare. So number one, the causes of headaches. So we can have pinched nerves in our neck or even in our upper back area, and that pinched nerve can actually cause radiating pain to the base of our head. We can have pain around our eyes or even around our forehead that can be coming from pinched nerves. We can also have lack of blood flow. If you're not getting proper blood flow and oxygen flow to your brain, that can actually cause headaches. More similarly, I see a lot of migraine headaches have issues with both of these. We can have nerves that are pinched in the neck, as well as blood flow and oxygen that's not getting to the brain to help it to function properly. So a lot of times you may feel pulsing or throbbing when we're getting that lack of blood flow. Muscle spasms are another one, kind of going along with those. When we have pinched nerves, a lot of times your body will adapt by actually spasming muscles to help protect that area that has the pinched nerve. And when those muscles spasm, they cut off blood flow. So all three of those kind of work together. We can also have arthritis can be a problem too, because when you have arthritis, the joints don't move properly, and that can cause some stagnation of blood flow. It can cause muscles not to move properly, and again, lead to pinched nerves with that arthritis, which is what we talked about last week, was more about arthritis and the pain from that and how that can contribute to a lot of other conditions. Another thing we can see is disc degeneration within our spine or disc herniation in our spine, and those herniated discs can actually pinch on the nerves and cause, again, radiating pain up into the neck or the head. I've also seen some pain go into the shoulders or even down into the mid-back as well. Jaw issues are a huge one that I feel like are so commonly overlooked. So when we're having any type of popping, clicking, or where it feels like the jaw is not moving properly when you open it, those jaw issues actually will cause tension here beside the forehead, and that can actually lead to headaches as well. So a lot of times jaw issues can cause headaches too. Stress is a huge one. So when we're stressed, we tend to deplete essential nutrients in our body, and that's going to cause muscle tension. And that tension, again, is going to affect your nerves, your blood flow, and those muscles that, again, are kind of the top three things that I see that cause headaches in my office. Hormones are another thing. So when you have hormone imbalance, or specifically certain times of the month, whether or not you have all your parts left, if you had a partial or even a full hysterectomy, your adrenal gland actually produces those same hormones. So if we have hormone imbalance issues going on, or if we're taking prescription medications for hormone balance, those hormones can actually become out of balance, which will cause blood flow changes, and that can actually cause some issues with headaches being caused specifically from hormones. So if you're noticing about a week and a half to 2 weeks before your period, you're getting a headache, or right before your period, or right after your period, or just randomly, you're noticing that your joints are sore, your headaches happening, those may be related to hormones. Dietary deficiencies are another one I see. So I already mentioned that, when you have chronic stress, your body will deplete certain essential nutrients, and that can cause some issues where headaches are more common due to, again, nerve function, blood flow, and muscle spasms are probably the top three things that I see that are the main causes of headaches in my office. Now, we do a combination of things for treatment. In our office, we do some joint mobility with chiropractic care. We also do massage as well as stretching and exercises. But in some cases, we may need to actually do some cranial work. So that means we actually do gentle pressure and massage over the bones of the skull and the jaw to help with alignment and helping restore some of that nerve and blood and also muscle flow and function too. So right now, the current problem with our current healthcare system is, number one, most medical providers get less than 5 hours of training on headache diagnosis and treatment. So that means a lot of the times people are being diagnosed incorrectly and prescribed the wrong treatment to help them. So if you have headaches, you've been dealing with those for years, you've tried medication, you've tried everything over the counter, you've tried a million different things and seen specialists, you're not getting results. We can't keep doing the same things over and over again and expect different results. You may need to try something different. But about 40% of headache patients are diagnosed and treated appropriately. So that means that 60% of people are not getting treatment that is appropriate for their headaches, which means they're not getting results and still dealing with those headaches. So tonight is all about overcoming those headaches. But a lot of times when we look at medications and current treatments, those focus on relieving the pain only and not fixing the problem. So that means we're going to keep having those headaches come back, and all we can do is do some medication or treatments to help manage those symptoms when they happen, not get rid of them and keep them away. So in our office, what we do is we focus on musculoskeletal systems. So that's going to be those joints and nerves. That's going to be the muscles and the blood flow. We want to find out what's actually the true problem rather than just covering it up with medication, rather than just dulling the pain so you can get through the day. And integrative offices like my office also use a combination of techniques. So like I mentioned, we use chiropractic, we do some physical therapy and physiotherapy in the office, we use massage, sometimes nutrition, and even stress management. And in some cases, we even have to look into hormone testing to figure out what's going on with your hormones so we can try to balance those out so your body can get some relief and you can overcome those headaches, not just live with them. So that's going to help to restore stability so you get long-term relief, not just oh, I have a headache, let's take some meds and hope it fixes it. And it's going to keep coming back. We want to actually get to the root cause, fix it so it doesn't keep happening over and over again, because who wants to be in the rat wheel when it comes to headaches? Those are no fun. So if you would like more information about what we do in our office for headaches or how we can help you, you can again give our office a call, 309-689-6200, or go on our website, freedompeoria.org, to learn more and also request an appointment. If you would like some references on those stats that I gave you earlier, I've got those listed here. So again, thank you for tuning in. I hope you learned something today. I always feel like when it comes to our office and the fact that we do things a little bit different than medical offices, people have a lot of questions, but that is a great thing, because when it comes down to it, you need information, you need education so that you can make better decisions for your health and your family. So if you want more information, give us a call, go on our website, or keep tuning into our videos to learn more every week. Have a great rest of your day, and hopefully you learned something this Wellness Wednesday. Join us next week as we talk a little bit more about lower back pain and what you can do to get rid of that without surgery. Thanks for tuning in to Freedom Chiropractic and Holistic Health. Don't forget to hit that subscribe button and ring that little bell so we'll let you know about some new videos coming out. Every Wellness Wednesday, we go live at 5.